Good afternoon. Today we have 4 new positive cases of COVID-19, 1 on Maui and 3 on Hawaii Island. Even though this is a few more than we've been seeing, we continue to have some of the best results in the country. Cases are low, and we can keep the streak going if we remind each other to keep safe, keep up with the practices that brought us here. Wash our hands, stay home when we're sick, keep social distancing. We have ample healthcare capacity, and our testing and contact tracing capacity continue to increase each and every day. With me today is Lieutenant Governor Josh Green with an update on our healthcare capacity and his other initiatives. The Lieutenant Governor recently announced the opening of a free clinic in Kalihi to help those who have been economically impacted by COVID-19. And I want to commend him for organizing and putting this together. Everyone in Hawaii has done a great job in coming together to flatten the curve. It's been difficult, but you followed the mandates, and I'm so proud of what we have all achieved together. These results were important metrics that helped us move forward with the Beyond Recovery Reopening Hawaii strategy, which I announced earlier this week. We are now in phase 2 of the reopening, which is the Act with Care level. To implement phase 2, I've been working closely with the counties on opening businesses and activities, and you will be seeing more requests from our county mayors in the coming days ahead. As indicated in the plan, phase 2 is also when we will consider lifting the 14-day inter-island travel quarantine. Health measures are pointing in the right direction to make this move. One key factor is the levels of infection appear to be controlled across the entire state. This was important because we did not want one county with a higher level of cases to infect other counties that have it under control. And with me today is Dr. Bruce Anderson of the State Department of Health, who will provide an update on today's numbers and give more perspective on how our health data supports the lifting of the quarantine. We have already begun the planning process on what needs to be done to lift the quarantine, and we have been in discussions with the counties and the airlines on what inter-island travel will look like without a quarantine. Key issues being discussed include screening, testing, contact tracing, all of the activities we need to keep our community safe and healthy. We are also addressing the staffing and other resource requirements on all islands in anticipation of an increase in the number of inter-island travelers. With me today is Tim Sakahara from the State Department of Transportation to give an update on the airport and to talk about some of the measures being considered to help facilitate the lifting of the inter-island quarantine. We hope to finalize our plan shortly, and we will provide updates on our progress. We are also going through the process of identifying other potential issues and welcome any thoughts and suggestions. I know some of you want us to lift the quarantine right away, but this is a major step in reopening our economy, and I want to make sure we have the systems and resources in place before we move forward. Remember that no plan is perfect, and we anticipate an increase in COVID-19 cases when we lift the quarantine. We have the capacity to handle this, and if a new surge occurs that threatens our healthcare system, we may need to reinstate some of the restrictions. The health of our community will always be a top priority. And when we reopen inter-island travel, we will still need everyone to keep up with our health measures, maintain physical distancing, wash your hands, wear your masks, stay at home if you're sick, and avoid large gatherings. Keep up the good work. Your friends, family, and neighbors are counting on you to stay the course in our battle against COVID-19. So please take care of yourself, take care of each other, and most importantly, help take care of our community. Thank you.
Thank you very much, Governor. Our next speaker is Lieutenant Governor Josh Green.
Aloha, everyone. It's a pleasure to be with you. Thank you, Governor, for that nice shout out about the Aloha Free Clinic. I really appreciated that. It has been an extraordinary time, and I want to say how much I appreciate the Governor's attention to this critical issue, which is bringing us gradually back to normalcy, and traveling between the islands is a big piece of that. As Governor pointed out, we just have 4 new cases today, 4 cases, and we've had very low numbers in the immediate past few days, as you know. This is very good news. To give people a little perspective, we've had 68 cases in the last month, so 68 in the last 30 days is very low, and only 21 cases in the last 2 weeks. So you get an idea that, as the Governor has pointed out, we're trending in the right direction, meaning that it is getting safer each day and week over week. And that's why the Governor is able to offer us this leadership to move toward opening up our inter-island travel. But what he has asked me to focus on, and Director Anderson to focus on, is making sure that our healthcare capacity all across the state is good, it's available, it is safe. That's one of the key metrics to making sure that we can take care of the people as we need it. So, couple important numbers. Our ICU beds across the state are only 39% occupied. These are historic lows when you consider the state of our healthcare system outside of a pandemic. Hospital beds remain about 50% occupied. For perspective, normally we'd be 80–85% occupied because of elective procedures, so we have a lot of capacity there. And then finally, our ventilator total in use is only 9%. Only about 40 out of our 459 ventilators are used right now, and even a much smaller number are being used, of course, for anyone suffering with COVID disease. So, as you can see, we have the capacity inside of our state to care for our people. And that's why the Governor is able to take the initial bold steps to get us ready for inter-island travel. Another very important thing I wanted to point out is we've had no deaths, no fatalities in the last 2 weeks, and we've remained the lowest mortality rate in the country at 1.2 per 100,000 people, total of 17 fatalities. So all of these indicators tell us that we are able to move forward as we begin to build our health economically, which is, I know, what's on a lot of people's minds. A couple other points in terms of personal protective equipment, which is also important because we will be doing more screening at our airports and at our hospitals and clinics and all across the state. We have to have enough PPE, and that's why we've been happy to report that we have increased our PPE available for our hospitals and clinics and clinicians. In fact, this was First Responder Week, and we were honoring them, and they've been using PPE, but very safely, and they've had enough. So our stocks are adequate. Hilton Rathel's team at the Healthcare Association has been extremely helpful in that way. We constantly look at worst-case scenarios, and even under worst-case scenarios, we've been building up our reserve and our capacity from a health standpoint to be ready. I shared with you what our total concerns were as far as fatalities and mortality rate for the state, but we also feel that we have to be very, very cautious moving forward, and that's why we're doing this thing very incrementally. Obviously, Attorney General, Director of Health, leadership there, they're putting together the process, so we really try to have an airtight system. If I may, we all know that inter-island travel is like our highway. Between other people have state highways, we have inter-island travel. So we're being very careful. But I will tell you that it is not just an economic consideration that we're making, obviously. We're also making a human consideration. In the last few days, for instance, we had a family who shared with us that they had a terrible car accident here on Oahu for their 30-year-old. And it necessitated emergency surgeries and ultimately the passing of that individual. But the family members were, of course, living on other islands. And through the process, we were able to get them over here carefully, and they went through our COVID exemption process. But there are more and more stories like this that we're aware of. people have a stroke and they need to visit at end of life their family member. We know people have appointments to make. We know specialty appointments are necessary, and even some of the regular things we do for business. So all of this resonates with us, but only provided we don't take greater risk and make people sick. So that's why it's my role to share that the governor's team is smart to get us ready to do inter-island travel. And then the last thing I wanted to share was inter-island travel is important, but so are haircuts. As you can see, my 9-year-old is way overdue for a haircut. So we also appreciate the governor and the mayor's working on these more mundane things. It's not all serious healthcare in hospitals every day. But aloha, and thank you, Gov, for all this work.
Thank you very much, Lieutenant Governor. Our next speaker is Dr. Bruce Anderson, Director, Department of Health.
Aloha. The prevalence of disease and the incidence of disease in Hawaii remains low throughout our state, but the ability of our state to reopen is going to be dependent upon our ability to respond quickly and appropriately to any new cases. We've seen over the last couple of weeks that we've been able to keep the case numbers very low, lowest in the country, and I am very pleased with that. But we are going to see new cases. We've seen today 4 cases. 2 of those were among family members, not unexpected, and 2 are still under investigation. So there's still a limited community spread, and we are going to see clusters from time to time. But our real strength is going to be being able to identify the cases quickly and the contacts, and of course be able to isolate and quarantine those as we go. But we feel we're in good shape to do that, and it's a good time to start looking at a new normal where we can once again resume inter-island travel. We reported recently on the ability of our department to respond to cases. We're training epidemiologists, epi-extenders we call them, to be able to assist with that, and hope to bring on at least 100 and possibly 200 or 300 individuals through the UH training program to be able to augment our staff as needed. We've also done a lot of work with the private sector and improving laboratory capacity. Last week we did a survey of all the labs in Honolulu and throughout the rest of the state, and I'm pleased to report that our capacity has increased dramatically even over the last month. The number of testing laboratories has gone from 5 to 11 today, which includes our state laboratory. And this includes testing laboratories in all 4 counties. All neighbor islands now have testing capacity, which was not the case just a few weeks ago. The inventory of test kits, the number of swabs that can be taken and processed, has gone from 12,300 2 weeks ago to now 38,382. So almost a 3-fold increase. That's just the materials on hand, and of course we can get more as needed. The number of staff trained to perform testing has gone from 68 to 135. Essentially twice as many people now are trained to do testing as was the case just a few weeks ago. The average number of daily tests performed in the state has gone from 418 to now 691. The maximum daily testing capacity has gone from 3,062 to now 3,600. This number is expected to increase significantly again over the next few weeks, and we have no doubt we're going to be able to test 5,000 or more as necessary. That's far more than what we're currently being required to test. So I think this is a good time to start looking at international travel. We are working with the Attorney General's office and others and what criteria would be followed in the procedures. We certainly want to make sure that as we look at inter-island travel, we're not putting anyone at additional risk and putting all the safeguards in place that we can to assure that that can be done in a safe manner. That concludes my report.
Thank you very much, Dr. Anderson. And our final speaker, Tim Sakahara, Public Information Officer, DOT.
Aloha, Governor, Lieutenant Governor, everybody out in the community. Thank you for the opportunity to update you on some of the things that DOT is working on. HDOT is working to implement any changes at the direction of the governor and state leadership. Discussions are already underway with key state departments and counties regarding the potential lifting of the mandatory 14-day quarantine for inter-island travelers. Now, it should be noted, the temperature checks for inter-island passengers would continue even if that 14-day quarantine were to be lifted. Also, a new form would be developed specifically for inter-island travelers. It will still have contact information, but would also add some health-related information and questions. Now, that form is not yet finalized and will have the input from our partners, including the Department of Health and the Attorney General's office. Now, there are additional discussions underway to identify any potential issues that may come up. For example, if someone flies from the mainland to Honolulu, they would be required to quarantine. However, if they had plans to fly to a neighbor island, let's say in 2 days, then that person would be needed to be flagged and tended with, especially with law enforcement input on that issue. HDOT is also grateful for the help of the Hawaii National Guard, which is currently taking the temperatures of all passengers, including those departing inter-island travelers. But eventually, the National Guard may be assigned to other duties, and we are looking to identify who would be able to step up and fill the need if they are no longer able to. HDOT has been proactive in researching thermal temperature scanning equipment, and thanks to the legislature for working to secure funding to help cover these costs. Now, we look forward to working with eligible companies that could be able to provide this service. Once the agreement with these potential companies is reached, we anticipate being able to set up a pilot project within about 30 to 60 days with this thermal screening equipment. We want to assure the public that we are not waiting, but in fact are planning for the new normal and what that will look like post-pandemic. Thank you very much.
Thank you very much, Tim. And now we move on to our questions from the media.